Hi there, my name is Nurse Master Charlie. Welcome to my YouTube channel, welcome to my nursing channel. I am a registered nurse, and on my channel I talk about nursing school related topics and tips, as well as health related topics, tips, and other information. Today's topic is on a pharmacology review of statins, what they are, the common names, and the side effects.
So what are statins? Statins are in a class of oral medications that are easily identified due to the suffix of the drugs ending with statin. These can include atorvastatin or Lipitor, lovastatin or Altoprev, simvastatin or Zocor, pravastatin or Pravachol, and rosuvastatin or Crestor or Elzalor. The generic names all end with statin. Also, statins such as simvastatin can be combined with other medications such as ezetimibe, an anti-LDL medication, which I will describe later in this video, to form Vytorin. And atorvastatin is combined with amlodipine, a calcium channel blocker, which is used to treat high blood pressure, to form Caduet. If the medication has the word statin on the end of it, then it's a statin. Check. So now that we know the different names and combination names, what are statins? Statins are medications that are in a class of medications called 3-hydroxy-3-methyl-glutarol-CoA reductase inhibitor, or HMG-CoA reductase inhibitor for short, which is much better and much easier to say. Let's take a steak or a pizza. Within these foods, there is LDL, which stands for low-density lipoprotein, better known as the lousy or bad cholesterol, and there is also HDL, which stands for high-density lipoprotein, better known as the happy or good cholesterol. These type of lipoproteins are processed through the liver and end up as cholesterol. So then this begs the question, what is cholesterol? Cholesterol is a white, fat-like, waxy substance that comes from the foods that we eat and is also made by our livers. Actually, our livers make all the cholesterol that our body needs. Yes, needs. We need cholesterol because cholesterol helps our bodies make cell membranes, hormones, bile acid production, vitamin D, and many other substances. So how do statins work? Let's say somebody ate this steak, which is then digested in the stomach, then processed through the liver. This causes the HMG-CoA reductase to go to work, which is then processed into mevalonic acid, ultimately forming cholesterol, which is then dispensed throughout the body. But what if this HMG-CoA reductase into mevalonic acid process could be blocked? This will lead to decreased cholesterol formation. Statins lower the cholesterol in the body by blocking or inhibiting the HMG-CoA reductase enzyme, hence the name HMG-CoA reductase inhibitor, which decreases our body's ability to make cholesterol. By doing this, statins also help in decreasing the risk of heart disease, strokes, and blood clots. So how are statins dosed? They are dosed in 10 milligrams, 20 milligrams, 40 milligrams, and 80 milligrams. If a dose is missed, it is recommended not to double the dose to try and catch up. Just take it the next day. One more important fact, if you have a female patient or know someone who wants to become pregnant or is pregnant, statins are contraindicated in pregnancy and lactating mothers. Statins are also best taken at night. What are the side effects of statins? The side effects of statins include but are not limited to myalgias, also known as muscle or extremity pain, tender muscles, joint pain, muscle weakness, fatigue, although it may be dose dependent. Also insomnia, dizziness, diarrhea or constipation, urinary tract infections, thrombocytopenia, headaches, and also hair loss. Serious side effects include rhabdomyolysis, liver failure or hepatitis, and its related signs and symptoms, cognitive impairment. Precautions should be taken in people who are at risk for diabetes type 2, people greater than 65 years of age, people with a history of renal disease and or liver disease, active alcoholism, and those with hypothyroidism. Other precautions are that statins should not be taken by people with a history or family history of musculoskeletal disorders, but a doctor would weigh the risks versus the benefits. Now that you know the side effects, there are things that can increase the risks of side effects of statins. So as a nurse, you will encounter many patients who take statins, so here's a few things you should be aware of. Now nurses have to know many things about many medications, but there are many patients taking these statins, and once you learn this information, you can have this in your arsenal of knowledge. Things to know to educate your patients that can increase the risk of side effects are: first, alcohol use. Better to limit or avoid if possible. Grapefruit or grapefruit juice. Specific types of medications can potentiate the effects of statins, such as fibrates. Specific antibiotics, such as erythromycin, azithromycin, and immunosuppressives, such as cyclosporine. certain blood thinners such as warfarin, antifungal drugs in the polines and azoles classifications. All these medications and non-medications and foods can block the metabolism of statins, leading to increased serum statin levels, leading to toxicity. Remember to inform your patient that statins are medications and part of their overall therapy and treatment. Medications are to be used in conjunction with lifestyle changes, a healthy diet, and exercise if not contraindicated.
So I just shared about what statins are, what the medications are in that class, what the classification is and does, what the doses are, the side effects are, and what increases the risk of the side effects. So if you learned a little something and just found some value, and if you are interested in health information and nursing related content like this, I'd like to invite you to subscribe and be part of my nursing channel, and also hit the notification bell so you can be made aware when I release new videos. Please be sure to check out my many other nursing topic related videos, from nursing assessments to the 5 rights of medication administration, as well as my nursing and health related music lyric videos here on YouTube. If you are not aware, I write and create nursing and health related educational music like my songs, What is Diabetes, Check Your Feet, the Flu Shot song, and the Nursing Process song, What Are Vital Signs song, to name a few. So if you like music and want to learn a little something at the same time, be sure to check those out. They are on all music streaming platforms like Spotify, AppleMusic, iTunes, etc. Also be sure to check out my nursing blog on my website, www.nursemastercharlie.com. I post new nursing and health blog articles weekly related to what I share here on YouTube, Instagram, TikTok, and Twitter. So until the next video, go save lives and make a difference in someone's life. God bless and goodbye.